absolutely adorable. Also completely changes the way. Next panel. I think it's possibly a good time now to take the pulse of what we have heard and where we are. We have a brilliant panel just to reflect on some of the things that we've learnt during this NHS Confederation conference. Please welcome to the stage Rob Webster, Chief Executive of South West Yorkshire Partnership NHS Trust. You've got Tracy Myhill, Chief Executive of the Welsh Ambulance Service, Dr Graham Jackson, Chair of NHS Aylesbury Vale CCG, and Sarah Pickup, Deputy CEO of the Local Government Association. Welcome. One thing you ought to know is that Dame Kelly Holmes is in the house, and all of these people have had selfies done, like excitable teenagers. It's very cute. I did too. It's fine. Let us start with you, Rob, because this is a weird thing for you. Come closer, it's too far away. So, until last year, you were the gaffer around here, weren't you? Chief Executive of the NHS Confederation, and now you've taken on one of these hats the STP has.
Yeah.
Which sort of felt more powerful and more like it could affect change, do you think?
Well, I think the behind that's something quite simple, I think, which is we do operate in a system. And what we need to have is the right connection, ambition, motivation from the centre, around the political will and the architecture around the arm's length bodies, through to what we all do in frontline organisations every day, which is try and improve the health and lives of the people that we serve and support the staff we employ. So the Confederation's got a role to play in that. I've got a role to play in that as a Trust Chief Executive, and as an STP lead I've got work to do in that as well. Can I get really close to the people that we support? Yes, because I just go out of my office and go and see them, which is brilliant. I absolutely love doing that. But I think everyone's got a role to play. And one of the reflections I would have on what I've heard this week is that I think Henry Marsh last night said, what he'd learned was that you should never lie to patients, but you should always give them hope. And that's a balance. And I think this week's been about balance. How do we make sure we're always honest about where we are, what the challenges are and how we're going to get through them in a way which builds hope.
Are you confident, because your shoulders are going to be carrying a really pretty heavy burden over the next 4 years? How do you sleep at night, really?
Who sleeps? No, I think my approach to leadership's constant, whether it's working in a network of chief executives or with my own staff. It's about supporting people, creating the right culture to deliver. You've got to do that through having a shared ambition, a shared set of behaviours, and an environment where you will work with each other to do the right thing. What I'm confident about, having looked at, talked to the people in my team, in my organisation, and worked with the other leaders in West Yorkshire, is I think we've got a chance to do that. The balance is, how do we do that in a way which, as Simon says, pushes investment in mental health, community services, primary care, social care, prevention, at a time when our acute hospitals are in crisis. So some of that balance will have to be maintained. I think the critical point I would make is it's just going to take time. So I'm more confident if we've got time to do the right thing and to make sure we make the right improvements.
Simon Stevens also did talk about social care. And it was mentioned during this conference, but perhaps not mentioned quite enough. Mentioned a lot more on the floor, I think, outside, than it was from the stage. Sarah Pickup, is that also your observation?
It is, and I think it's not just about social care, it's about the offer that local government's got in a place. We few from local government here have felt welcome. We have felt that there's a lot of people undertaking innovations in their local areas and engaging with councils, with council leaders, and particularly on social care, but also in public health, in housing and other things that can help. I was pleased that Simon obviously mentioned social care, and particularly, perhaps even more pleased, he mentioned the quality of local government leadership at the end of his speech. I was slightly more concerned that the Secretary of State didn't appear to refer to any of the integration agenda and the stepping up to the place document that was launched at the beginning of the conference, jointly produced between the health and care sectors. So I think that there's much goodwill, much good work. lots to build on, lots of great examples I've heard this morning in places I'm going to take away. But I think that my reflection is that stepping up to the place is STPs with an extra T, and the extra T has to be together.
You've got a local government conference happening fairly soon.
We have, yes.
In a couple of weeks, is that right?
Yeah, 4th of July.
4th of July. Is the message that's going to go out from that platform there at that conference going to chime with the message that comes out from this platform here?
Well, so it will to an extent. So in many of the workshops that I've been to, the message is absolutely the same, and it's coherent, and it's about population well-being and health. And actually, you know, rather than the purpose of an STP being to reduce hospital bed days, actually that's a byproduct of a healthier population. And the objective is to work together to get there. And that will be a theme at the local government conference. And there will be a sister document to the one we launched on Monday, which is about, okay, that was the vision. How do we take this forward together?
You were nodding throughout that, Dr. Graham Jackson. A lot of this obviously makes sense to you.
Yes. And interestingly, I'm reflecting, I was nodding about the LGA conference, because I remember last year going to the LGA conference and launching a document and finding myself as the only medic and the only commissioner in a room of local authority. And this is a reversal role this year, but so we're building on that. And we're talking before, saying it's been a lot more local government input, but actually I would like to see a lot more, so I'm reflecting on that. So I think there's an issue about relationships across the whole sector, and I call it one sector, should we say one sector here. My reflection from these few days is I think I'm beginning to get a sense of permission coming through. So I think we've had, you know, years and years of regulation, and quite rightly so, when there are considerable quality issues in the system. But I'm hoping now, as we start to understand and embed quality in all our activities, the regulatory activity can almost step back a bit and allow permission, and that allows people to build their relationships and therefore be much more productive across the sector.
I mean, I keep banging on about structure, because I just think structures make sense, and maybe I'm just a bear of little brain, but I want to know who's pulling in which direction, and are people pulling in the same direction. It struck me, and I don't know whether it struck any of you, but when the Secretary of State was talking, he talked a lot about critical care in hospitals.
Yes.
Right. Okay. Yes.
Well, he didn't mention primary care.
He didn't at all.
Or
so what does
care
that?
Or primary
so
care.
what does? So yes. Okay. You've already said that you noticed that omission. So yeah. What do you make of the fact? Whose inbox matters more, and does it matter that he didn't mention primary care?
Well, you're going to ask that question again on June the 24th. After what's happening in 2 weeks' time. I don't think it matters really particularly. I think Simon did mention it quite clearly, and the leaders in this conference, this brings together leaders of all different types. So whether providers, commissioners, primary care, social care, the leaders, I think, in this conference do understand moving that in the same direction. So that's where the power and that's where the understanding needs to be sitting.
If I can bring in Tracy on this, I know that health is a devolved issue, and you're looking over from Wales. But I guess the challenges are pretty similar that are being faced in Wales as are being faced here?
Absolutely. I think the theming of the conference, you know, the way the conference has been themed on localism, culture, workforce, has been a really good way to bring all players into the debate, because our population is not significantly different. Our population is ageing, so we face similar challenges. We may have slightly different ways of structuring our NHS, but ultimately we can learn from one another. And the Manchester experience, for example, yesterday, we got an added opportunity from Wales to talk to Sir Howard in a bit more detail. There's so much learning across the border.
What's the biggest takeaway you take from Sir Howard's example, for example?
Well, we've in Wales, we've got the Wellbeing of Future Generations Act, Wales, which has just come into being, and we're setting up public service boards. We're doing that right now, which brings all the key players into the room. And that's what he was talking about yesterday. All the key players in the room together, one plan for one population, leaving your organisational boundaries at the door. And that's all about leadership. And that's what I got significantly from that conversation. It's a leadership challenge to walk into that room and almost forget the organisation you're representing. We must represent the people, whether they are our carers, our patients, our citizens, our staff, and forget the fact that we've got these boundaries.
Yeah, I mean, one of the things I thought really everybody felt fairly lucky to have the patient voice so represented in this conference, because it is pivotal. I think actually, why don't we invite you to join in this discussion? If you want to make a comment or also an observation, put your hand up in the air and we'll come to you and you can join us. It would just be really lovely to have some of your opinions expressed as well. That ask, Rob, as somebody who sort of headed up the NHS Confederation, we are inevitably, and we started off talking about this, that we're talking about big beasts in fiefdoms that have been unassailable until now. And it's fine to do the talking, but when you are in straitened financial circumstances, to do the walking is a very different matter. What makes you confident that that will happen?
So I always focus on what can I control and what can I influence, and I don't really worry about the big beasts if they're not in my field. So what I really want to do is say, what are we going to do then, and what do we push back in terms of the system about what we want to achieve for the people we're supposed to serve? It's pretty clear to me that my staff don't get up in the morning and think the first thing that they're going to do is worry about what Jim thinks or Simon thinks or the Secretary of State thinks. What they're going to think about is, how do we get the best out of the work that we love doing today? And what I want to do is to create a local set of leaders who've got an ambition and a plan for the local place that we live, work and operate in, where we're confident that we can achieve what we set out to deliver. So on that footprint, what I would say is our plan's going to be our plan, and then we'll test it against the checklist we're given. We don't start with a checklist from Simon and Jim and their teams and then say, we better write a plan that says this. If we go down that route, I think we're all dead in the water. So I think the challenge for everybody in the room is, how do we get to the point where we feel confident that we're given the headroom politically and through the system to get on with the right thing? Now, one of the encouraging things I've heard today is that there's a narrative that's emerging about, well, what do we need to do this year tactically, and then what do we need to do in the future? So one of the biggest shifts is to move away from single year, single organisation planning into multi-year planning with some really strong tactics and a clear narrative which we can all get behind. Okay. Now, that's got to be locally driven and nationally supported.
We've got a contribution here. Could you say who you are and where you're from as well, please? Oh.
Hello.
Yes, you are now.
It's Tim Cotton from West Hampshire. The common denominator here for integration is the patient, the citizen. Do you think our STPs are doing enough in terms of co-production with our citizens?
Well, you're the STP here.
I'm not.
Take that, yeah.
So the STP is a collection of leaders in a network. It's not an organisation. I don't run a health authority, so I think everybody's involved in an STP. What I would say is at a local level, our STP is built up of the local plans. And I would say there's some amazing work going on in different places. Does it infect every conversation we have at West Yorkshire level? No. Should it? Yes. If we built capacity in communities, would be more sustainable? Yes. Is there an opportunity through place-based planning to get better at that? Yes. I think that we need to look at the thought leadership, sharing good practice on it, and make it something that's really just part of the everyday business of what we do.
Sarah and Graham, do you want to come in on that?
I think I would echo that. I think the everyday business, that's what's important to me, is actually an STP is a collection of individuals who are trying to drive the same direction. And of course they're in their infancy. But the individuals or the individual components are really engaging now with the population in the way they weren't 5 years ago. So I think that everyone is building that in, and it's almost part of the furniture. And one of the crazy, and so therefore that collective activity is coming through. So I'm more confident that we're going somewhere which is much more population engaged than where we've come from.
How much heart did you take from something that Jim Mackey said? I asked him, I pushed him on the social care thing, which was, that there is an uneven terrain. I mean, we'll all accept that there is an uneven terrain between these two sides, where you feel, I guess you guys are on just much firmer ground than they are. And he said, if we need to, we will shunt money, 1 million here and 1 million there. And if people don't want to, we can kind of make them. Was that a message that you that thrilled you or convinced you, or do you have your doubts about it?
So I suppose I think that wouldn't be the way I'd put it. I think it's about working together and pooling resources to get better outcomes, having a population focus, and having a kind of but back to co-production. I mean, co-production will happen on the ground. It won't happen at STP level, and we need to involve citizens, because this is about people taking responsibility for their own health, as well as it is about how should our service be. And I think going back to the big beasts, if we don't get a parity of expectation that this co-production, person-centred, population-focused work is as important and in fact is the ultimate aim of our systems as A&E weights and numbers of hospital days, which should be a byproduct of a healthy population, not an objective in their own right.
Yep.
If we don't get that parity of expectation in the mindsets of those leaders of the systems, then all the people who have got that in their mindset might be undermined because they will revert to what they are held to account for. So I think that there's a really important task there to continue to build on what is positive progress in terms of what you said, Jim mentioned. You know, that is progress, but there's movement still to get.
Tracy, did you want to come in on that?
We don't have STPs. I'm not sure if that's good or bad, so I don't understand the detail of how they work. We have a different system, of course. So we have an integrated health board system. So we are responsible for population health, primary care, secondary care, community services, mental health, through to tertiary services. So from that point of view, we've got a lot of the key people in the room at the moment. And as I said, moving forward now with public service boards, that should give us the opportunity to strengthen that structure with the citizen at the centre.
Yeah, I mean, it was interesting. The OECD came out with some figures that said, you know, you're devolved and you walk to your own tune. Mm-hmm. That's a really terrible metaphor, but you know what I mean. Yeah. But the outcomes are pretty similar when you look at the really important benchmarks. What do we take away from that?
Well, I think, what I take away from that and the conclusions I reach is no one system is necessarily better than another. And that's why I think it's absolutely critical that we learn better together, because some things we're better at, some things our partners are better at. Okay. But overall, I think the bottom line was no one's way ahead or not of anyone else.
I think there is something important about the Wales experience in terms of where you decide to focus has an impact. So by focusing on social care in Wales, what you're seeing is a turning of the curve in demand and a difference in delayed transfers of care from what you got in England. So if you make strategic choices like that, you can make improvements. And I think that's really important for us to grasp. And it is politically brave because you didn't have a cancer drugs fund. You said, we'll put the money into social care. Yeah. So I think if you've got political bravery, if you own that locally, if you decide what you want to do for the best for the whole population, then you can live with the consequences.
Let's take number 2. You have a question.
Hello, I'm Paul Grimsey from Devon County Council. It's clear that local authorities and health services are going to have to at least hold hands in order to move forwards. What does the panel think that we need to understand and learn from about each other's cultures in order to do that?
Let's go to Graham first on that.
Oh, thank you. Great. That's a very good question. Cultures, of course, I think there's more than just cultures between local authorities and health. There's cultures within health that are different. So I think from all the partners have a different cultural background that we need to start breaking down. We did some discussion earlier on today with the Ray Council about relationships. And I think I come back to what I said earlier about permissive behaviour. It's not only about relationships, it's also about asset understanding. So there's this difference about how health leaders get where they are and how local authority leaders get where they are. The elected, not elected debate goes on. But actually, if we have a shared plan, a shared direction, we need to understand what our shared assets are. And then it's back to that issue of, what asset who can bring what to the party. So I think it's more a broader question than that way.
Let's go to another point from the floor. Yes, hello.
Hello, Sally Johnson, NHS Blood and Transplant. We heard about money being held back with the promise of it being then distributed for innovation at the point when the control totals are met. Should we be spending that money now to make sure the control totals are met?
Who wants to take that first? Very good question. And nobody does, so I'm going to...
Well, after what Simon said, when Simon said earlier on that we're going to be looking at resetting the finances, I think none of us know what that really means. So that might mean what was held back may not be held back. I don't know.
I think it's one of the biggest issues that affect the conversations that I have as an STP lead. So 1% of resources top sliced and held centrally. I think in West Yorkshire our preference was not to do that, but the suggestion was that we should to manage risk locally. We spend more time on that than we do on the 10 billion quid that we do spend. So I'd rather not worry too much about that 32 million quid. I'd rather think about what's the overall resource in health and care and how has it been invested to best meet the needs of local people. I do worry that unless we get the narrative right and a 2, 3, 4 year plan right, We won't reset the acute finances, we won't have resources for primary care, mental health and community services, and we won't succeed. So that is the biggest challenge for us, I think.
We're running out of time, it's going red, but I'm going to take one more. Number 2.
Hello, Hayley Richards, Avon Wiltshire Partnership Mental Health. How does competitive tendering fit into a future landscape dominated by collaboration through STPs?
Who would like to take that? Somebody, you've got to be more gung-ho about this. Go on.
It fits in, so different things for different places and different times. There should be no assumption that you need it. There should be no assumption that you don't. I think local systems have to make the right decisions about what they need for which service in their area.
I'm going to just an end. Yes, very.
So I think there is an important thing in this about until now, has anyone really been taking a perspective about the unintended consequences or the combined consequences of different tenders at different times in a place? And it's pretty clear to me no is the answer. And what you can see is that there are people doing things for good reason about changing services in their patch, which will have an unintended consequence in the next patch or on a single provider that covers more than one patch. If we can have a bit of leadership in an STP that says, we decide on collaboration or competition based on patient needs. That's what the law says. So if it's in the patient's interest and the public's interest to collaborate, we should. And then what we do is we coordinate that in the way which is going to give us the best impact that we can, given the capacity we've got to make the change happen. And if all the capacity is tied up in doing competitive tenders not change, we're in trouble.
Can I just ask, just before we thank all of you, and it's really lovely to have a panel with such diverse experience together talking about this. How confident on a scale of 1 to 10 are you that you're going to get round this U-bend unscathed? Sarah, if we start.
Unscathed? Which is good and which is bad? I mean, we won't get through unscathed, so somewhere in the middle. I mean, 5.
5, okay.
It's non-negotiable. We have to go around it. Scathed, battled, embattled, embittered.
So bruised, but we'll get there.
Collectively,
okay.
we will get round it.
Well, we have to learn from one. So it's what kind of punishment are we going to put ourselves through to come out the other side? So what we've got is to learn from local government. 5 years ago, if you'd said to local government chief executives, the challenge that faces you is deliverable, I think some of them were in a bad place. They're now in a place where they've been through that. They've made huge changes. We need to go through the same kind of process, I think, where we're saying, this is going to be really tough, we'll have to make tough choices, but we'll make the right choices. And when we come out the other side, we'll be in a better place.
And I know it's devolved, I know it's different. So perhaps just a pulse take on what your 2020 might look like.
Well, it's interesting because the U-bend is a slightly different shape for us, but I think there's no doubt that we all have significant pressures and we're all in a place where we need to become more efficient and spend less money. So, as I say, the systems are different, but the vision is very, very similar. We've got to take care closer to home. We've got to base on population and citizen need, and we have to work better together as a system across the whole system to deliver for the patients and the citizens we're there for.
Well, look, thank you all very much indeed. Please join me in thanking our panel, Rob Webster, Tracy Myhill, Graham Jackson and Sarah Pickup. Thank you.